So welcome everyone. Everyone's coming on right now. So we're waiting for everyone to get on before we start live. Let me see where we are on the count, Chuck. So it looks like we're at 200. Why don't we start about 500, Chuck, and maybe you can give us a little update as people are coming on. I'll let you know when we get to a 500 count. It's moving up. We're at 503. So the first thing we'd like to know is, Chuck, can you give us a little update about supplies and what's going on with supplies and what dentists can expect when we go back to work, which is really exciting.
So we're all very, okay, thank you very much. We're all very excited that dentistry is going to swing back into work in a few weeks. At Benco, the number one question we've been getting asked is what will be the access to PPE, personal protective equipment. So I think everyone will be happy to know that our inventory is starting to fill in. We put a multi-million-dollar order in with 3M for N95 masks. We've also been working very feverishly on face shields and some other protective products. We do believe we're going to have the products you need to go back to work when it's time to go back to work. And we are working hard to make sure that we get the right products to the right place. So if Indiana is opening before California, we want to make sure that the dentists in Indiana get access to the products they need to go back to work. We will still continue rationing because rationing is the only way that we can avoid hoarding. And really in the current situation where there's not enough supply, the main issue is we can't have a doctor have 1,000 boxes of masks in his office when somebody else is still waiting for his or hers. So we are going to continue to ration. We are going to make sure that we have the products we need when dentistry opens. And please reach out to your friendly Benco rep or call us directly if you have any questions. So we're in it, we're on it, and we're all in it together. So thank you.
Sounds like we're ready. It sounds like we're ready to go back to work.
Absolutely. Hopefully.
Well, with that being said, I think we're up to count now. So I definitely want to welcome everyone for coming on today. My name's Kay Huff. I'm the Director of Coaching for Benco Dental. So we definitely want to welcome you. We also want you to know that in the lower part of your panel, you'll see questions and answers. We may not be doing live Q&A. However, we will make sure that we respond as soon as we can to your questions. So please make sure you still type your questions in because we definitely want to know what you're thinking or what your concerns are, or if there's anything that we can answer for you. So with that being said, I have the great opportunity and privilege to introduce who I get to call boss, who I absolutely love and adore, and who has done nothing but support his team with constant reassurance that everything's going to be good. And I really admire you, Chuck, for that. So with that being said, I'd like to introduce Chuck Cohen, Managing Director for Benco Dental.
And thank you very much, Kay, for having us today. We are very flattered and honored to have Dr. Chad Gehani, who is the president of the ADA. We were speaking a little bit before we got started today, and this certainly was not the role that Dr. Gehani envisioned that he would play when he took the oath of office as the president of the ADA back in the fall. So he was very gracious and agreed to come on today, and I'm going to ask him some questions, and I think there are questions that we all probably have, and we're looking forward to hearing from him. He's at the center of the crisis, certainly. So Dr. Gehani, welcome. We're glad you're here today, and thank you for taking the time.
And thank you for having me at your webinar and giving me an opportunity to say hello to your listeners. Thank you.
Thank you very much. So I thought we would start with, could you tell us a little bit about your personal journey? I find it fascinating. I know you were born in India, and from India, you made your way to the United States, and now you're the president of one of the largest organizations of healthcare professionals in the world. Talk to us a little bit about where you came from and how you made it to where you are.
Well, I'm an ordinary man who was born in a poor family in India, and there were no dentists in my town. There was one dentist who used to practice part-time, and only rich people who had plenty of money can go and see the dentist. So somebody like me, it was like a dream come true for me to go and sit in that fancy dentist chair. That was like a big deal for a kid in a high school. So when I went to college, I decided that I'll be a dentist and I will serve the underserved. Once I became a dentist, I thought that there's a lot more to learn than what I learned in the dental school back in India. So in those days, the US immigration laws were so simple that all that you needed is $25 and a degree in dentistry, and walk into the American consulate and just tell them I'm a dentist in India and I wish to go to United States to live there as an immigrant forever. And with that $25 and 2 to 3 months of waiting period, they gave you a green card in the hand, in an envelope, which we brought it, that envelope, we brought it at the JFK. They opened the envelope, they gave the green card to us, and then they told us, you're on your own. So when I was 24 years old kid, I collected the $25, whole $25, which took me more than 6 months to save those $25.
Yeah.
I got in New York City, and the first thing I did is I appeared in the United States Federal Court. I arrived here on Sunday night. Monday morning, I was in the federal court, and I told them that I have a green card and I intend to be the United States citizen as soon as I will be eligible to do so. And the question they asked me is, why do you think you wish to be the United States citizen? And I used 2 words: liberty, freedom, and justice for all.
Wow.
Those were the words that I used. I got my license. In those days, you could take the National Board Part 1 and 2, which was easy for me. And then you could take a bench test, which was on the mannequin. And if you pass those 3 tests, you could appear for the clinical exam like any other American United States graduate. And if you pass that examination, you had a license to practice. And I passed all of them within less than a year's time. Got my license, went back to India, got married to my sweetheart, a childhood sweetheart, Mrs. Gehani, Rekha Gehani. We came back here, and I practiced general dentistry for 2 years. I practiced, if you're familiar with New York City, I practiced on 64th Street and Park Avenue. And I was one of the richest young men at that time. And I practiced for 2 years. I also practiced over the weekend. In those days, they used to call their version of DSOs. There was a place in Roosevelt Field Mall called Dental World. I worked for that particular place for about, I would say, a year. I decided to go back to Columbia University to do my post-graduation in endodontics. And upon graduation from Columbia University, we opened the practice right on the next day of my graduation in Jackson Heights. And I still maintain the same practice.
That's exciting. So what drew you to endodontics? Why did you decide you wanted to move from general to be an endodontist, to be a specialist?
Because that was the subject that I was not good at. In India, in the dental school, they did not teach us rubber dams. They did not teach us root canals the way the root canals are done in United States. So I decided that I wanted to be an endodontist, go back to India on a part-time basis and serve the community, which I did. I would go back every 2 to 3 months in India and serve the poor community until a wise man whispered in my ear, and he whispered saying that you should be teaching the teachers so those teachers can teach the incoming generation of how to do modern root canals the way you practice in the United States. So at one time, I was a visiting professor for about 6 different dental universities in India. And I used to travel at my own cost. And once we saw that there were enough trained endodontists in India, I slowed down on my visitations to India and started concentrating more on, of course, my family and
Exciting.
my surroundings in Queens.
You said you have 2 children and they're both dentists.
I have 3 children, 2 are dentists, and 1 is an MD.
Ah, congratulations.
Thank
So
you.
how did you get involved in organized dentistry? What made you decide you wanted to get involved in the ADA, and I'm sure the endodontists, the association AAE? What made you decide to pursue that?
You know, the community is a community. I always believed in working with the community and making a difference. So when I was a kid, I would go to our temple and serve our community at that time. When I was here in New York City, while I practiced general dentistry, I will go to the neighboring church and I will serve the church. The dental community is no different than any other community in the world. You need to be part of the community and you need to serve the community. And if you want to change that community, if you want to be the change, you should be the change. So I joined Queens County Dental Society upon invitation by Dr. Richard Mascola, who at that time was the president of the American Dental Association. And he just called me and he said, hey, Chad, I want you to come to Queens County and be part of the board of trustees of Queens County Dental Society. So he had pretty much handpicked me, or he recruited me to do little work in the community, not knowing that from being the board member of the Queens County Dental Society, I will then become the president of the Queens County Dental Society and then the president of the State Dental Association. And I had never dreamt or thought of being the president of the world's largest, most powerful, most influential, and an organization who always puts the patients first. Be the president of that organization. And I'm happy to serve my 164,000 bosses. All the members are my bosses.
That's very nice. That's the right way to think about it. And they are your bosses. And I respect that.
And they can call me, they can write to me, they can ask me any question they feel like, and I feel obligated to answer them, let them know what's going on. And I like to do it on a first-hand basis.
Oh, well, thank you. And one of the things that's definitely come through loud and clear is how approachable you are. And that's very important because not every ADA president has been as approachable as you are. So thank you for that. And so talking about the ADA, certainly the last few weeks, the ADA has gotten more scrutiny than in the past. Talk to us a little bit about how the ADA makes decisions, especially in a time of great crisis and great change. There's the staff, there's the volunteers, there's committees. Talk to us about the process, if you would, about how the ADA makes decisions, some of which are difficult and challenging in a world where you don't have all the information.
You know, many times people do not understand the ADA. ADA's goal is to advance the public health. They want to promote the art and science of dentistry. We always think of patients first. As a matter of fact, our members, all the members of the American Dental Association think of the patients first. And in general, why do the young people decide to be a dentist? They are people's persons. They want to be around people. They want to serve the community. That's why they are dentists. We have a structure where our supreme body is the House of Delegates. They are our legislative body. They give us our marching orders. They decide our policy. Then we have board of trustees, which is 23 people, 17 board of trustees, plus the officers. They are our managing body where we decide our day-to-day operation. And these are all volunteers. And then we are advised by 10 different councils. Each council has 17 representatives representing 17 trustee districts. the United States is divided into 17 trustee districts. Some of the larger states like California, New York, Pennsylvania, Illinois, Florida, those are single trustee districts, and some of the smaller trustee districts are combined together. And the councils are our more of an advisory body who advises us on professional and policy and other matters.
Mhm.
So any decision that we make it's not made by one person, and it's not made in vacuum. We are also supported by 450, I call them my co-workers. These are the experts, very knowledgeable people. So we have the experts in science, we have the experts in dental practice, we have the experts in insurance, we have experts in all different fields. They will propose or they will write the reports for us, and they will let us know what's going on, and we, the volunteers, make the final decisions. We decide what to do, and our co-workers usually decide how to make that happen. So it's a great system, and there are checks and balances within the ADA.
Yeah. So certainly, I think most people want to understand in a world where there's so many things we don't know about infection control and dentistry and aerosol. It's not really, I don't really think we want to talk about what are the decisions, but what are the specific groups? Who's actually going to figure out the science, and who's going to actually start to come up with the solutions of how dentistry is going to be different in the world going forward post-COVID, or not post, we're not even near post. We're only in the mid phase of what is going to be a long-standing issue. So what committees, who's involved, and what role do you play in making the decisions around what dentistry looks like when it reopens?
See, as a community, we are involved in lots of other bodies. We are in touch with, you could say, almost every dental specialty organization. We are also pretty much in direct contact on a regular basis with the governmental and regulatory agencies. We have been talking to, let's say, the CDC, the Center for Disease Control, pretty much on a regular basis. We have been in conversations with the FDA, Federal Drug Administration. We have been talking to FEMA, for example. We talk to the people at the White House, and we are in regular touch with all those people. We have a group of scientists. We have our own Institute of ADA Science and Research Institute. So that gives us plenty of knowledge about the science. And it's a collaboration of lots of different organizations, including, for example, the DTA. You are pretty much familiar with the DTA. We work in collaboration. If I tell you that ADA just works in a vacuum by itself, that doesn't happen. We work in collaboration with everybody.
Mm-hmm. So when it's a collaborative process, though, and there are difficult decisions, is it the scientists who are going to weigh in? Is it the dentists? And when do you think we'll get some very clear, direction from the ADA on what dentistry looks like from a PPE perspective and infection control? Do you think that's something that we're going to get in a few weeks? Is it a few months? Are we learning as we go?
You'll probably get some of the recommendations, I would say, by the weekend. Okay. About 2 weeks ago, I had appointed a task force for dental practice recovery. These are 5 pretty well-talented, well-qualified dental practitioners. So these are not retired dentists who you will say that they're not thinking. These are wet finger dentists. They get a lot of information from our division of science. They get a lot of information from our division on dental practice. We also have been talking to all the governmental agencies that I just mentioned to you earlier. Last weekend, we actually issued some interim guidelines on the PPE, specifically on what kind of mask and face shields that the task force had recommended to us. This weekend, we will be issuing some more guideline of how to go back to practice and what to do, and how to welcome the patient. The reception room may look like a little bit differently, and interviewing the patient on the telephone may be slightly different than what it used to be 3 months ago. So the whole world has changed within the last 6 weeks, and we want to help our dental practicing community as best as we can in every single field.
Yes, and one of the things that's very confusing, and I'm not a dentist, but I clearly know a lot of dentists, is when dentists go back to practice, it really helps if the ADA makes a statement on what to do, because it prevents anybody from going off too far in their own direction when it comes to insurance, when it comes to patient care and taking care of the team members. Making sure that everything is aligned with what the ADA recommends is very important. And so I think that's why everyone's looking for that guidance.
Yes, and I think this weekend, this Friday, we will be doing a webinar with OSAP, OSAP. That's yes. The full form is Organization for Safety, Asepsis, and Prevention, specifically on PPE. That was the request that few of my colleagues asked me on the telephone, and anything that my colleagues ever ask me, it usually turns into an action, and we are there to support our entire practicing dental community. And at the heart of our action is always the patient safety, the dentist safety, and of course, our partners, which is the dental team, the dental hygienist, and dental assistants and dental receptionists. That is always in our heart. And at the present time, with what is going around with aerosols and unknown enemy that we call it, the viruses. And every day we are learning something new. Every single hour we are learning something new. What we are mostly concerned is the safety of the people that we serve. Yeah. And that's very important to us.
And I think along those lines, what we're hearing and what I'm hearing is that there are a lot of dental team members who are concerned. When we saw a few weeks ago, there was that graph in the New York Times talking about dentists and hygienists at the high end of a dangerous profession. I think a lot of us said, wow, that we really never thought of it like that. What's your advice for practitioners who are dealing with team members who are very concerned about their own safety and are thinking maybe about not coming back to dentistry as a career?
Well, dentistry is a wonderful career. If I have to do it over again, me, my wife, and my family will again become the dentist. You serve your community well. Dentistry is still safe. You have to have some faith in your employer, your dentist. You have to have some faith in your own organization. The fact that in the month of March, we made one of the most unpopular moves. That was a decision to recommend closure of dental offices. That wasn't made in a rush, or I did not wake up one morning on 16th of March and decided that I'm going to call my ADA staff and tell them that everything comes to standstill. We have our division of science working on the unknown enemy for about 2 weeks. Mm-hmm. we put in our thought process very carefully into it. And we decided that it will be safer for our communities, not only the safety part, but also to help out the community. And that's why we recommended that we will postpone all the elective procedures, but we will keep our offices open for the emergency treatment. Mm-hmm. And the Surgeon General of the United States actually called me on my cell phone. Wow. And he asked me one question. And the question was, he first thanked me for recommending to close the offices. And then he asked me a question and he says, can I ask you, why are you keeping your offices open for emergency treatment? And I said to him, you know what? If we do not do the emergency treatment, these patients will come to the emergency rooms of the hospitals and they will jam up your emergency rooms. That will distract the physicians and the dentists and the medical personnel from providing other care to the COVID victims. So we wanted to take it upon on our own. That decision was very painful. We wanted to mitigate the social distancing at that time. We also wanted to preserve the PPE for more important reasons, such as the MDs and the nurses serving our patients. And we wanted to keep the emergency rooms open. Usually there are about 2 million ER visits every year. And with that recommendation, there was an initial shock by certain of my colleagues. I got some angry calls, but at the end of the day, they all realized that that decision was not made in a very light way. It was made with a lot of carefulness. 2 weeks ago, we surveyed our dental community, and 97% of our colleagues have closed their offices, but they are open only for the emergency room, emergency care of their patients. 18% of the dental offices are totally closed as of now. So when we will be recommending, and these will only be recommendations, a dentist is a trained dentist. The dentists are good in understanding the pathogens. They are trained in that. We survived the challenges. I remember when I was trained at Columbia University, I had no gloves in my hand. Right. I used to do root canals with bare fingers. That was in the 70s. Yep. In 80s, when the AIDS came in, the HIV came in, that sounded like the end of dentistry. And the same question was asked at that time. Dr. Gehani, will your dental hygienist and dental assistant return to your office knowing that they might get HIV transmission through the patients? But then we started taking proper precautions, and that is a history. Similarly, this stage will pass by. Mm-hmm. Yes, this stage will pass by.
Yes, and I agree with that 100%. I remember the 1990s when we put universal protocols in, and it was a very, very big change for dentistry. I'd like to come back to that in a few minutes. Let's talk a little bit about the March 16th decision. You certainly have received a little bit of criticism over that and some heat on from some of the ADA members, and these are difficult decisions. How do you feel about that now? Do you feel it was the right decision? And how do you feel dentistry has reacted in general?
I can tell you that I will defer the answer to that question to my members. Yeah. My members have actually called and thanked me. Right. The ones who were annoyed at that time, even those members have sent me emails telling me, wait a minute, Chair Gehani, we were annoyed at you, but now we want to thank you. The ADA made a great decision, and that was again, when we make such type of decisions, it's very painful as a president of the ADA to make a recommendation to the entire community. And it is not just the United States. We are pretty much followed globally by the global dental community. So what happens in the United States, or what the ADA does, many of the international dental associations pretty much follow us. So that wasn't a simple decision just made on the 22nd floor in Chicago. But if I have to do it over again, if I have to make such a decision, which will be safe for our patients, the public, for my members and the practicing community, and of course for my support team, such as dental hygienists, dental assistants, I will do it over again in a heartthrob. And that's the right thing to do.
And it's fascinating to hear, and I agree with you. The question that we have, and really this is something that hasn't come up in a long time, is neither dentists nor staff members nor even patients have been concerned about their own safety about the dental office. That seems to be a big change, and something that dentistry in general has to figure out what to do about. We have people who are afraid to leave their own homes, let alone go to a dental office, let alone go to a restaurant. So how does the idea of being afraid about safety change a little bit around the calculus for the ADA and for how you look at things?
Well, once we go back to our office, I can tell you that the practice of dentistry will not be exactly the same as it used to be in the month of, let's say, January and February. Right. Ourselves will be a little bit more educated. We will be taking the precautions. We will be using proper PPE. And that's why when you were speaking to me and you were telling me about you have so many masks that you just ordered, and my immediate reaction was, what did I tell you?
You said, make sure you keep them for customers. We need to get them to dentists.
I said to you, give it to my boys and girls.
That's right.
Those are my boys and girls,
Yes,
my colleagues, the dentists, the dental hygienists, and of course, my dental team members. I want all the supplies that you have in your warehouse being properly distributed to my folks. And you know what I mean by my folks. And I want them to be very safe, and I want them to exert proper precautions. And of course, this stage will eventually pass by. We will learn some lessons. I am learning every day. Every hour I turn the news channel on, and I usually get the chance to see the news early in the morning at 5 a.m. and then in the night at 11 p.m. There's a big difference.
Interesting.
And we're learning.
We're all learning. So let's pivot to a related topic. Talk to us a little bit about the testing process. Do you envision, and does the ADA envision, that dentists will be doing a lot of testing of patients? That's new. If we compare back to the early 90s with HIV, there was never a discussion about should dentists test people for HIV. So this is a new change in dentistry and even a new conversation. So could you talk to us a little bit about testing and the protocols around it, and how involved you and the folks at the ADA feel like dentists in general should be with testing of patients and staff members?
Well, the dentists are very highly skilled and trained people. I don't see a reason for the dentist not to get involved in testing. That's my personal opinion. You know, I happen to teach at the university, at New York University, and I see the graduating class. And each year I sit in the back and I see our graduates come out of the with a cap and gown. As I said to myself, these guys know so much more than Chad Gehani. When Chad Gehani graduated in 1973, these guys are so smart, so talented. I don't see a problem in dentist testing. As a matter of fact, I wrote a letter to HHS about 2 weeks ago, asking that the dentist be involved in testing. The trouble is, there are about 40 different tests available in the market. They all claim superiority over others. How many of them are really FDA approved currently at the present time?
One.
Only one.
Wow.
Okay, and there's a limited supply.
Mm-hmm. Yes.
And we don't know yet the false positive and the false negative.
Mm-hmm.
My son, who's an MD, he's an ear, nose, and throat specialist. And he also had closed his office, and they were planning to open their office next week. So he went to get the test done, and along with his colleagues, and some of his colleagues who thought that they had HIV, who had the COVID-19 virus to some degree, they came out to be negative.
Mm-hmm.
So we don't know if those tests at the present time, it is still very evolving science.
Mm-hmm.
If I had a magic wand, and if I was the king of the world, I would have given the testing to all my colleagues in dental community and tell them, here we go, you have the test. But that's a wish list.
Mm-hmm.
It may not happen so fast.
No, not at all. And one of the things that we're concerned about is exactly what you said, which is there's a lot of tests on the market that don't really work, or they're not handled properly, or they're not refrigerated when they need to be. And I'm with you on that. And I think there's a lot of confusion out there in the market about dentists buying just the first thing they can find and making some bad decisions, and especially around the tests. And I saw you were very active on that over the weekend with your letter to the membership.
Absolutely, because I want to be sure that my colleagues are well informed, and the public, of course, is well informed, and of course, safety is first. And I do know some people who have invested and paid a lot of money, as much as maybe $30, $35 per test, and they might have bought like 10,000 pieces of that test, and I don't know how good that testing material may be.
So one of the things you mentioned before that I want to come back to is this idea about the dentist as a scientist. And I think maybe before this whole episode happened, there were a lot of dentists who might have said, you know, I don't really think of myself as a scientist. I think of myself as a professional, or I think of myself as a service provider. But can you talk for a few minutes about this idea about dentists as scientists, and maybe how that is more important now going forward than it ever has been before?
Well, dentists, doctors, they all are scientists, and we operate in a small mouth, in a small area. The infection, inflammation, repair process is no different in your head, or in your nose, or in your hands, or in the mouth. The disease process is the same. And by the training, the dentists undergo all kind of sciences and everything, and they apply all those basic sciences in the practice of dentistry on a regular basis. So over the period of number of years, if I have been in practice for the last 38, 39 years, I'll probably forget that I am a scientist first. I'm a doctor first. I think of the infection, inflammation, healing, same like anyone else. And it is always an evolving process. I remember when I was being trained, there was only one material that we did the cavities, the fillings with.
Mm-hmm.
And that was what?
Amalgam.
Dental amalgam.
That's right.
And what do we do now?
A lot of different things.
And
way more than just dental amalgam. Yes.
And that is called science.
Yeah. So as you speak to your colleagues recently and going forward, what are the kind of things that they should be watching out for so they remember that they're scientists? Are there more journals that they should read? You have recommendations as far as the CDC, the ADA, and how do we make sure that that our dentist colleagues keep that in mind? Because I do think that's so important going forward.
You know what? I'm going to be a little selfish here.
Mm-hmm.
I'm going to remind all the dentists who are listening to you now that every morning and every evening, log on to ada.org/virus.
Okay.
And also look for ADA morning huddle every morning. I do that. Being the president of ADA, I think I know it all,
Mm-hmm.
but no way.
Mm-hmm.
Every time I log on to ada.virus, ada.org/virus, I learned something new. And for us to keep us up to date, that's what we like to do. There are some nice journals such as Journal of American Dental Association. It is most modern and keeps you up to date on what's going on in dentistry. If you are a specialist, every specialty has their own journal. They pretty much keep you up to date. And then again, I happen to read New York Times and Wall Street Journal, and there are certain articles that I find very interesting and very educative, and that pretty much keeps me quite busy.
Excellent. Looking out into your crystal ball, what do you think are the one, two, three things that are going to change the most in dentistry from this experience with the COVID-19? What are the two or three things you think will have the biggest change for the profession?
I would say number one will be the PPE,
Mm-hmm.
the personal protective equipment. That will change. We will be placing much more emphasis on the PPE. Not that we didn't do it before, but now it will be much more vigorous and it may be a little bit more involved. Again, sterilizing. Not that we did not sterilize before, but people will be more concerned. More than that will be hand hygiene.
Mm-hmm. Yes.
Hand hygiene. Every 2 hours.
Really?
Every 2 hours.
Yep. Indeed.
Can't hurt.
No, it cannot.
It will not hurt.
We agree. And I think there's a lot of dentists and practitioners out there who think that if they wear gloves, they don't have to wash their hands. And clearly we know that that's not true. You need to wash your hands and wear gloves.
I wash my hands after every patient that I finish. I take the gloves out. My habit is I usually I have a little private bathroom that I get in my bathroom and wash my hands with soap and dry them with a disposable paper towel. And of course, then I wear a new gloves. The other thing that might change is, I'm a person who always like to hug people. My dental friends will tell you that Chad Gehani likes those big hugs. I'm going to have to somehow train my brain and my heart not to do that and go back to the Indian way of greeting people, which is called namaste. That says it. That says it all. It says good morning, good evening, good night, and hello, and have a good day. So the social habits may somehow change.
Yeah. And then what are two or three things that you think will not change with dentistry? What are things that you think are going to be just as important tomorrow as they were yesterday?
The procedures, doing the root canal, for example, doing the crown and bridge, for example, those things will ever keep getting evolving, but they will not change because of the new enemy that we have down the block now. So the dentistry will not change, but dentistry will advance, and it will advance for the better. And dentistry has always advanced for the better. No matter how much obstacles dentistry has faced, we the dentists are very resilient to a lot of changes, and we always come out ahead of the game. So at the end of the day, the dentist, the dental hygienist, and of course, my team members, I cannot do without my team members. We will be the winners, and we will do well.
Absolutely. There's some talk in dentistry that we as a profession, and I say we because I'm involved, although I'm not a dentist, we as a profession will get regulated more like medicine has been regulated. Do you foresee that that's an issue? And if so, how does the ADA plan to deal with with this idea that there will be maybe a higher level of regulation, and or dentistry will start to look more and more like medicine from the regulatory standpoint?
You know, rather than calling the regulators as them and us, I usually call the regulators as us. We can work with them, and if there is, let's say, a rule that will benefit our patients, and it will also advance the art and science of dentistry, I am always for it. But if there is an undue burden on the community of dentistry, which will increase the cost of doing the business of dentistry, and of course, who pays for the cost of increase of the business?
The patient.
The consumers, the patients.
Yes.
If that happens, and if that regulation is undue, I would fight for it. I would absolutely resist that. So I always consider the regulators, it could be the state or the federal regulators, or it could be even the third-party payer. I always call them as my partners. And they are good-hearted people. If you reason out why you are opposing certain things, or why you are proposing certain changes, they are people like us. So I don't believe that the regulators are going to put any undue, harsh, burdensome rules on us. But working together, specifically nowadays, we have been working with the CDC and with FDA. They are our partners. And I intend to continue to work with them.
And dentistry seems to have a very good seat at the table, is the term I would use, when it comes to the Surgeon General and the FDA and the CDC. So maintaining that relationship, I would think, is so important. It must be a very important piece of what you do and what the other folks at the ADA do all the time. Yeah,
I can very proudly say that the ADA is generally the leader. We lead, we are at the head of the table on majority of the subject matters. And that's a good place to be. And I enjoy sitting as a head of the table and making the decisions which are in favor of our patients and our practices.
Indeed. Let's talk a little bit about industry for a minute. That's certainly where my angle is. So what is it that industry can do to help advance dentistry, especially now in these times? What do you need from us as suppliers, as manufacturers of the products, and a key player in the business going forward? What do you need from us? Please ask.
Absolutely. You know, you will agree with me that the dentists are essential healthcare workers.
Yes.
And
Agreed.
they are very important. They are the ones who promote and they take good care of the oral health. And a good general health begins with good oral health.
Yes.
So as an essential healthcare workers, the sooner in a safer atmosphere we go to practice, what is it that we need from you?
PPE right now. Yes.
So any number of supplies of PPE that you have, and we started our conversation off the record prior to speaking in public. I said to you that give every single PPE that you have to my boys and girls. That's exactly what I want. And this is the time where as a small time practitioner, I am not able to write like fat checks. So I'm concerned about the pricing. I do understand that there is a shortage in the market, so your cost might have increased. But if you can consider distributing the PPE at a relatively less profit to you, I'm not telling you give it away for free.
No,
I do understand that the cost of, you just said that you imported X amount of 3M mask. I understand your base cost might have increased, but do not put too much of the profit there. Give it to my boys and girls.
We understand, and thank you for saying that. And I wanted to give a chance for you to talk a little bit about reputable suppliers, because I do think that Benco, we pride ourselves in being one of them. And like Shine and Patterson and others in the market, there's no price gouging that goes on. Some of our costs have gone up because our costs have gone up, reflecting the supply and demand issue. But I thought it was really interesting how you talked over the weekend in your letter to the members about making sure they're buying from reputable suppliers. And I was hoping you could revisit that again today, because there are a lot of suppliers out there that are selling counterfeit products, or people are buying things from websites that they've never heard of before. And it's just not a recipe for success.
Well, I deal with the three bigs and with the TDSC. Again, to me, the TDSC is a very reputable supplier to me. They are run by the dentist in California. I have no problem in buying any goods or any merchandise from them. And you three, Benco, Henry Schein, and Patterson, all three of you, I have personal relationship with many of you, and I appreciate your long-term friendship, especially with your dad for so many years.
Thank you.
I never signed a contract with your dad, by the way.
Thank you very much. That is true. We go back a long way.
It used to be, Larry, this is it. And he will say, okay, Chad, you got it. And
thank you.
So we appreciate that. And I appreciate the friendship. Yes, there is a lot of gray market. And I know you cannot say that, but I can, that there's a gray market out there, and they may not be reliable. Their products may not be 100% genuine, and they may appear to be cheap. But I tell my friends, and I tell my dentist colleagues, buyer be aware. Right. The buyer has to be aware of what products they are buying, and are those safe products? Right. Do they really give you the same amount of safety as, for example, if I bought the mask from you with the so many microns of filtration,
yep.
Yes.
Yep. Yep. Thank you. No, that's great. So thank you very much. Let's pivot a little bit to the DSOs. What role do you think the DSOs should or shouldn't play in, I mean, not in dentistry in particular, but as we emerge from this crisis, what would your expectations be, if they're any different, for the DSO community than from the independent dentist community?
First of all, DSOs are us. They are part of me. It's just the way that they do business is slightly different model than us. Their employees are part of my workforce. They are our members. They happen to decide not to get involved in the business aspect of doing or the profession. They only want to treat the patients, but they don't want to deal with the billing and employee and other relationship. The DSOs are no different than anyone else. So I have no problem in dealing with either employee dentists of the DSOs or the DSO owners and DSO administrators. They are part of the dental community. And at the present time, we have as high as about 9% of the dental workforce, the dentist practicing community, working for the DSOs. And many of them are even in the leadership position at the American Dental Association, and I welcome the DSO dentists with open arms. They're
Thank you.
part of me.
And they're one of your bosses, as you said before.
Absolutely, they are. They are my bosses, and they are part of us.
Yeah.
They're no different.
So one last question, because we are getting to the end of our time, but one last question. As dentistry emerges, is the ADA talking about maybe an advertising campaign or some sort of a national presence that we could have that will make the patients feel safe in the dental chair and or encourage patients to come back to dentistry?
That's why I appointed a task force on dental practice recovery about 2 weeks ago.
Mhm.
That task force has only worked for the last 2 weeks. They only had 10 meetings in the last 2 weeks. The latest meeting was about 2 hours ago.
Yeah.
I haven't seen their recommendation. That was their immediate goal,
Mhm.
to give us some guidance of how to go back and receive our patients and all that. The task force will continue to work, and they will give me recommendations. One of their charge, of course, is to how to go back to the public and make the public understand that our dentistry is important, and it is, from my point of view, the dental office is the safest place to go. The dentists are trained people. They are very much trained into finding the infections and how to deal with infections. And of course, dentists are always interested in the welfare of the community. So those messages will be going out to the public shortly. Absolutely, we'll be working with them. And of course, we will be looking forward to partner with people like you and the DTA to work together collaboratively to go to the public and let them understand that the dental community is waiting to treat the public.
Thank you very much. Well, Dr. Gehani, thank you for spending the hour with us. I very much appreciate it. On behalf of Benco and the industry and all of our viewers, thank you very much for your kind and frank work and your answers. And most importantly, thank you for working 24/7 on behalf of this profession. We need people like you to step up and represent us, even in times of crisis and especially in times of crisis. So on behalf of everyone out there, thank you very much to you, to the other volunteers, and to the ADA staff for doing what must be done to get dentistry back on its feet and to make sure that dentistry is successful and we can serve the patients that we all love to serve. So thank you very much for being here, and thank you for spending time with us.
Thank you, and let the members, let the dentists know that the American Dental Association has every dentist back, and we believe in making every dentist succeed. Thank you.
Thank you very much, Dr. Gehani. Have a wonderful evening.
Thank you, and you too.